Welcome back. Today we begin a series of prediction of treatment response in psychiatry. Psychiatry is way behind the medical specialties where we can predict treatment response by having certain blood tests or EKG recordings or other tests available. In psychiatry, we want to look directly at the brain and determine from brain activity how we can assess whether certain therapies might be predicted to be effective more than other therapies. That's particularly important in those therapies that are extremely expensive and labor intensive, such as psychotherapy. So today we'll discuss a paper that looks at the treatment response of obsessive compulsive disorder, which can be treated with psychotherapy, exposure and response prevention therapy. It's quite labor intensive, it costs time and effort, it's difficult for patients, and you want to know in advance which patient responds to the treatment. So this group here that I'm reporting on today, published in Proceedings of the National Academy of Sciences, came up with a way to look at the activity of the brain prior to treatment and predict who will respond to psychotherapy. It's called multi-voxel, multidimensional assessment of resting brain activity. And in the next slide, we see the procedure collecting resting state functional magnetic resonance imaging from adults with OCD, and then use the power of machine learning to cross-validate the predictors that were pulled out of the machine learning algorithms. So then here, this OCD study was done in follow-up to a study that used treatment with psychopharmacology, namely serotonin uptake inhibitors, and it was noted that certain circuits in the brain changed with successful treatment with a serotonin uptake inhibitor. And so this was then the inspiration to see in a non-biased way which circuits might be important in predicting treatment response for psychotherapy alone. So in this case then, the brain connectivity was assessed in a multivariate analysis. Multivariate analysis looks at multiple data points in a non-biased way. You wind up with big matrices of data points which can be put into the mathematical analysis. And this allows you to look at patterns of activity and patterns of connectivity that might be important in predicting the treatment response. So here's a paper that delineates various networks in the brain. We are, in this case, particularly interested in the default mode network. This is a network which is active when you're sitting in the scanner, minding your own business and not being exposed to any cognitive task or demand. We tend to gravitate in this kind of situation to thinking about ourselves. We call it self-referential thinking. And OCD is a paradigm case of self-referential thinking. We worry about contamination. We go over and over certain behaviors again that we have done, and double check and cross check. So it's really the paradigm of self-referential thinking. So this group then used the default mode network as one of their targets. But they also looked at other networks. In the next slide, you see the approach that were taken. They looked at the frontal parietal, the cingulate opercular, which is from the cingulate cortex to the frontal cortex, the default mode, as well as ventral attention, dorsal attention, and somatosensory and motor networks. So all these data points were collected from these networks and plugged into a machine learning paradigm. In the next slide, you see how this works. We have the feature set extracted from the machine learning paradigm, specifically a vector machine, And we can correlate this with the Y-box, which is a rating scale for the severity of obsessive compulsive symptoms, and also with any particular medication exposure, which is a binary variable, namely was the patient on medications or not. And then features can be extracted, namely the correlation of data points belonging to various networks in the brain, and looking for those data points that correlate highly. In other words, those brain areas function together. And this is reflected, of course, in the fMRI activity, which measures blood flow and indirectly neuronal firing. So in the end, we wind up with a lot of correlation factors. And the strength of these correlations then are plugged into a feature detecting machine, the vector-supported machine learning algorithm. The slide here refers to the technique of leaving out certain features, so not to overestimate certain features. It's a statistical safety measure. And eventually you wind up with predictive value, which you then compare to the actual values that you are found, and you can compare those in an R-square correlation coefficient analysis. Next slide shows you here some of the findings that were made, namely the patient population here is an N of about 42. You can see that these folks responded very well to psychotherapy. The Y-box post-CBT and pre-CBT differed quite significantly, going down from, for example, 24.6 to 15.0 with a significance value of 0.001. Likewise, obsessions and compulsions, when subdivided in the symptom cluster, also improve significantly. The HAM-A is an anxiety scale, which also significantly improved, because it's well known that obsessive compulsive symptoms go along with significant manifestations of anxiety. So here then is the key finding. Look at the left part of the slide, the default mode network. And so the connectivity points that were collected from the default mode network correlated with the actual post-treatment Y-box scores. In other words, the correlation matrices from the default mode network predict the reduction in the Y-box reduction of the severity of symptoms of obsessive compulsive disorder obtained by psychotherapy. So when the default mode network pre-treatment functional connectivity values were used in the features set, the classification was most powerful, capturing 67% of the variance of post-treatment Y-box scores. Now, 67% of the variance captured is a very highly significant event in any biomedical study. So this then is a very successful prediction. In the next slide is a summary here. So the brain connectivity far exceeded more readily obtained a priori clinical information in the prognostic value for treatment response. Now this has implications for identifying those who will benefit from CBT, as well as for understanding the pathophysiology of CBT. So the study then marks a success in predicting response to CBT for OCD on an individual patient basis. In other words, you can put one patient in an MRI scanner, obtain these correlation coefficients, and you can make a prediction in a 7-minute resting state scan as to who will respond to psychotherapy. So this then is a significant advance that we have here in predicting treatment response in obsessive compulsive disorder, predicting the efficiency of psychotherapy in each individual case. So this is our first in a series of lectures in which we briefly summarize predictors of psychiatric treatment response. Thank you for your attention. We'll see you soon again at Behavioral Health 2000.